too tired could be either the resident says, I'm too tired, or it could be that the resident is really, really sleepy for some reason and you can't wake them up enough to do their treatment. Then you would enter TT for too tired. And the last reason is weather related, so W. We found that sometimes on very, very hot days in the summer, residents just didn't want to do exercises for no other reason than it was too hot. So we created that reason. Whatever reason you enter on the program log is the same reason that you're going to enter in Coligo when you do your stats. And we do keep track of the reasons why residents are not participating in treatments. In nursing homes, it's also very important to document, because if they're on RI that week, then it's actually documented on their RI report. Maybe they didn't get all of their days and minutes that week because they refused. It's actually part of the report. So it's very important to document the reasons why people are not doing physio if it's in their treatment plan. At the bottom here, you're going to print, well, type, because this is a computerized form, right? You're going to type the PTA's name and put a slash, and then leave spaces for the PTA to sign their initials on the original form once it's printed. If you have more than one PTA in your home, you just type the one name, put a slash, leave some spaces, type the next name, put a slash, leave some spaces. You can fit up to 3 or 4 names on here. And then the PT's name, same thing, type their name, slash, and leave the space for the PT to sign. If somebody's having TENS for a treatment, for example, you would write TENS left shoulder times 15 min. If they're having wax hands, or right hand only or left hand only, times 15 min. And then when they have that treatment, you're actually documenting how many minutes they had the treatment for. So once you've actually documented all of the numbers, here at the just underneath that bolded thickened line, it has a check mark with did well or an asterisk for C notes. If the treatment that you've documented on the first there, everything was fine, all you need to do is put a check mark and then sign your initials on the PSP initials line. If for some reason part of that treatment didn't go so well, or there's something that you feel needs to be documented, instead of putting the check mark for did well, you would put an asterisk in that little box, and the asterisk means C notes. The notes that we're referring to are the physiotherapy progress notes, and this is what it looks like. It's basically just a sheet of paper on both sides with a bunch of lines and room on the left side for the date. Important to put the resident's name and date of birth on the top on both sides. And when you start to have when you have a second progress note sheet, I usually number them 1, and then the second one I put 2, or you can put 1 and 2 on the back side, whatever you decide, as long as they're numbered to help keep things in order. So if you put an asterisk here for something that didn't go well in the treatment, you would then come and write your full note here. So I've been using January 1st as the example. So here you would write January 1st or Jan 1 and the year. Please always put the year as well. Then you would do your full SOAP note. The SOAP note is SOAP, subjective, which is the resident's complaints, objective, which is what the findings are that you're writing about, analysis, which is what you're going to do or what you think about it, and the plan. So for example, if you're a PTA writing this note, you would write S, resident complaining of pain with pulley exercises, for example. O, pulleys not done due to pain. A, pain. P, please reevaluate resident for exercises, for example. SOAP notes are very often written by the PTs. For the PTAs, it may be difficult to fill all 4 of those criteria, so you could also just write a note that says, resident complaining of pain with pulley exercises, Did not do pulleys today, please reassess. PT to reassess, something like that. Okay? So there's a documented note that something went wrong with the treatment. Now, once you've written that note here, how do you let the PT know? Because we don't always see the PTs every day and we can't always tell them verbally. And you know what? Leaving little sticky notes is not the best thing, because that little sticky note could get lost. It could get stuck under another sheet of paper, and now the physio is not alerted to the fact that you wrote a note about somebody having pain and asking for a reassessment. So we created, this is called a progress note, we created the progress note checklist, and this is what it looks like. Basically, when you put an asterisk on the program log because something in the treatment went wrong, and you have to write a note about it, you alert the physio to the presence of the note by writing on this checklist. So here we are talking about January 1st. You would write January 1 and the year. The resident name, you don't have to write the full name. You can just write J. Smith, for example, or Jane S. The comment would be simply C note, and then you sign your initials. The PT, the first thing that they do when they come into the home is they look at the front of your binder for this checklist to see if you've left them any notes over the past week or the past couple of days since they were there the last time. Okay? When the PT sees J. Smith C note, they'll go into your binder, they'll pull up J. Smith's progress note, they'll read your note, and they'll co-sign your note so you know that they've seen it. And they'll also write the date that they read your note and sign their initials saying that they've read your note. Okay? The same thing goes the other way. So PTAs, whenever you have to put an asterisk for something that's gone wrong for a treatment, put an asterisk, write the note in the progress notes, and alert the PT to the note on the progress note checklist. In a community setting, I think the best way for you guys to communicate seems to be by email. So once you've written a note in the progress notes, just send a quick email to the PT saying, note written on J. Smith or something like that, so that they know to check when they go in about your notes. PTs, when you go and do your day at the home, it's important to let the PTA know who you've seen as well. So on the progress note checklist, what I do is I write January 7th. I write the resident name, J. Smith, C note. If I rewrote a note to the PTA, I may have written resident. Now I would do my full SOAP note. S, resident complaining of pain with pulleys. O, I would write what I find for range of motion if there's a painful arc, whatever it may be. A, pulleys not appropriate. P for plan, discontinue pulley treatment and do active assisted arms up or active assisted shoulder flexion instead, something like that. Or sensation testing may be done, add ice times 15 minutes or something like that, if you want them to look at the note. Sometimes what I'll do, also, this helps the PTA, if I'm discontinuing a treatment and I'm adding another one, I've documented it on the progress note. I will also then go to the program log, and I will, so if pulleys is at the top, if I saw them on January 7th and I'm discontinuing pulleys on January 7th, I'll write DC on the 7th, and I'll cross off the rest of the days on the line for pulleys and initial it at the end. So the PTA knows when they come to do their treatments, if for some reason they don't read your note, they come to the program log and they're going to see pulleys DC, oh, I don't do pulleys anymore. And I'll also cross it off on the bottom month. Okay? So there's no possibility that they'll do pulleys anymore after I've discontinued it. If I added instead active assisted shoulder flexion, I will manually write, because these are done on the computer, remember? I'll manually write AA-ROM, right shoulder flexion times 10 reps. I'm adding it on the 7th, so I'll write add in the little box under the 7th. I'll cross off the 1st to the 6th because the PTA couldn't do it then. I hadn't added it yet. And I will sign at the bottom of the 7th here. And because I wrote a note, I'll put an asterisk here, alerting the PTA to the presence of the note just in case they didn't see the checklist, and I'll sign my initials. This is how we keep track of what treatments are discontinued and added. Is I will actually go and do it on the program log myself, because it's happened too often that things have been missed, and even though I've discontinued it somewhere on a quarterly assessment form or on a progress note, SOAP note, sometimes it doesn't get carried over to the program log, and so I will actually go and make the changes on the log to make sure that what I discontinue as treatment and what I add as treatment is actually done. It's the best way to be sure for the resident's safety. So on the progress note checklist as a PT, I could write C note / C log, or simply C log if you didn't write a big note about it. Okay? And then the PT would sign their initials. And when the PTA reads the note, and I suggest all PTAs check that progress note checklist after your PT's been in. Check it the next day, because chances are they've left you a note. They should have left you a note. I will also write, when I do quarterly assessments with people, I'll write the date, and now I'll have a few entries. I'll write the date, say January 7th, J. Smith, C note / C log. I'd sign my initials. That's for the one I just described. Then I'll write J. Doe, quarter, like the quarter sign, quarter done, continue. So my PTA knows I did the quarterly assessment, and to continue, there's no changes. Sign my initials. J. Apple, quarter done, C log. Maybe when I did my quarterly assessment, I decided to discontinue something and I documented it on my quarterly assessment form and add a different treatment. I'm alerting the PT that I've done the quarterly assessment and to go check the log because there's changes. J. Peach, new resident, C log. I'll often go and do the program log up for my PTA if I can get on the computer with all of my treatments for the new resident on it already. So that way they can either go see the printed copy if I was able to print it for them, or they can go into the computer and print the copy off. If I did not have a chance to do the program log, I'll say J. Peach, new resident, C initial assessment form, and please do log up, or prep log or something, so that they know that I didn't do the log and to please prepare it. And that's why I write my treatments very specifically, not only for college guidelines, but also because sometimes I need to ask my PTA to prepare the program log. I'll also have maybe J, I'm running out of fruits here, J strawberry, 85V done, continue, if I did my 85th visit assessment, and that'll be described also in this video. So all of the residents that I see, I write their name there and the comment, whether it be continue, C log, C note, prep log, whatever it may be. Okay? So the PTAs know everybody I've seen. And I find that this system with the program log, the progress notes, and the progress notes checklist is the best system to communicate between PT and PTA, because we're not always there together every day, all day. And to be sure that the treatments that are discontinued and added for residents are done and communicated to the PTA, I find that this is the best method to do it. PTAs, when you receive the notification that there is a change on the log, I suggest that as soon as you see any manual changes on the log, go into the computer and change it that same day, update it right away, because you're printing these off every 2 months. The last thing you want to do is wait till the last week of the second month to go and have to do all the changes for all 60, 70, 80 of your residents, however many had changes. It's going to take forever. Instead, do a few changes every week for the residents that the PT is seeing. That way you keep up to date with your work.